Hey, everybody. My guest today is Professor Sarah Conley, and we're going to talk about the limits of liberty. Thank you so much for being here.
Thank you for letting me talk about my book.
I'm curious to hear what your argument is in regards to the limits of liberty. I was hoping that you could summarize the argument.
Well, what I argue is that liberty does not have value in itself. As philosophers would say, I argue it has no intrinsic value. It only has value insofar as it is a means to something good. So it has instrumental value. And obviously, it's hard to prove what has intrinsic value and what does not. And I'm not going to prove it. But what I argue is that if you look at our practices, not always at what we say, but at our actual practices, you will see that we believe that a given liberty is important only if it leads to a good outcome. If it doesn't lead to a good outcome, we don't think it's important. And I think when we realize that, despite the rhetoric we have that often talks about liberty is valuable for itself, we should then go and revise some of our practices. So the first part of the book, which is kind of the theory, is where I argue that liberty only has instrumental value. Then in the second part, I say, given that, here are some changes we should make in medical ethics and environmental ethics, and what I call the ethics of self-expression, which covers both religion and speech. And I'm sure there are a number of changes we should make in those areas. I don't talk about all of them, but I talk about what I think are a couple of representative ones. And again, I'm arguing that although this might look shocking, it isn't when you look at our practice. For example, we say in the Bill of Rights we should have freedom of speech. But then we immediately turn around and we say, well, you shouldn't have the freedom to reveal state secrets. You shouldn't have the freedom to walk down the street threatening somebody. So what we really mean is freedom of speech is valuable and we should have the right to engage in it in certain contexts, but not other contexts. It depends on what it gets you.
Thank you for that summary, and that makes a lot of sense to me. I agree. It's really hard to argue for something having intrinsic value. I actually don't know of an easy way to do that other than just using reflective equilibrium. Um, yeah, but when it comes to liberty itself, I find myself in that position where I am not entirely sure if I believe it is intrinsically valuable. I'm pulled in different directions. Part of me does think it is, but part of me also does not. So the way that you have kind of structured the argument, it sounds like you're coming at it from a consequentialist framework. Is that correct?
I am not arguing for consequentialism in general. I am saying that liberty is something which we value for its consequences. And that could be compatible with various non-consequentialist views. So I'm not taking on a whole normative theory or meta-ethical theory about what is right. I'm saying, look, in this particular case, we value liberty when it gets us something good, but if it doesn't, or if it gets us something bad, that's the real problem, then we should limit that liberty. And I argue again, we know this and we do gradually change our practices when we have a liberty that has bad consequences. The problem is sometimes it takes a long time for that change to happen. And sometimes we don't have that time. So in a case like this, if we're talking about the environment, for example, it's like, okay, if we sort of gradually have come to the realization that we need to control people's actions in order to prevent climate change, by the time we decide that, oops, it's too late. And that's an obvious case where we need to think now instead of just waiting for the zeitgeist to change. But again, I think it's true in other cases, like the cases in medical ethics where we're hurting individual people right now by allowing them the liberty to hurt themselves or to hurt them other people hurt other people in the name of patient autonomy. And I can say more about that, but there are aspects of patient autonomy you should respect, and there are other aspects you should not.
So when you talk about consequences, are you talking about well-being?
Yes, I am. And I think, again, it depends what you think well being consists in and what you think is the good that ought to be promoted. But for myself, I do think in terms of well being, which is itself a complicated term. Uh, I am a subjectivist about well being. That is, I think that what makes you well off is achieving your own goals, as opposed to an objectivist who sometimes says, it doesn't matter what you want. This is what makes you better off. I think we want to make you better off in terms of your own goals. However, of course, it's not just you, it's everyone. So we are trying to look at what makes most people better off. So, yeah, it is consequential as to that extent, but I think that's fairly benign. It's like, yeah, let's make people better off if we have a practice that's hurting them and that doesn't bring about anything that we value. That's not a good practice.
So I just want to get some clarification on, I guess, the starting point of the argument. You were saying that if we look at how liberty has been valued in our society, we see that it has not been valued intrinsically, only instrumentally. Okay. Now that's different from making the claim that you think liberty ought to be only valued instrumentally. But are you also saying the latter claim?
I think the theory is both descriptive and prescriptive. That is, I say, yes, this is how we think of this. That's descriptive. And I say that's as close as we can get to showing what has merely instrumental value is to look at what we believe. Given that, prescriptively, we ought, given that that's what we really believe, we ought to make some changes in particular practices. Because, again, although rhetorically we also often say liberty is a value in itself, you have to respect liberty no matter what, we really don't think that. And so we should do the reflective equilibrium and say, okay, given that we really think it's useful and good when it leads to something good, like free speech that leads to democracy, yay, we should also stop it when it leads to something bad.
All right, so I think it would be useful to kind of go into specific examples. Since you just mentioned free speech, why don't you start there?
Okay, well, for example, we in the US, but many countries allow special latitude to speech when you're talking about public figures. So, like people running for president. You can say things about them that you normally wouldn't be allowed to say without repercussions about private citizens. And the idea behind that is that, we need open discourse about something as important as a presidential candidate. But I think we should limit that. I think there are two kinds of statements that we make. Some are purely evaluative, my opinion, and some are claims about fact. So if Trump says Obama is not an American citizen, he's making a claim about a fact, and it's a false claim. It was obviously false. It's always been false. And it's harmful because even though it is obviously false, he had enough of a following so that people would believe him and that could influence their vote. So I don't think people should be allowed to say that. I think the normal laws of libel and slander should apply. On the other hand, if Trump wants to say Obama is horrible and he'll be a terrible president, okay, that's an evaluation. That's his opinion. You can't really prove it's right or wrong. It's like, fine, you can do that. I think that these claims, which we normally recognize in discourse, should apply to public figures too. So I think I should be able to say, oh my God, Trump is awful. But if I publish Trump cheated on his taxes, that's a factual claim. And I don't have any proof of that. I don't know what he wrote on his taxes, and I don't know what's legal in tax law. So it would just be a false, well, I don't know if it's false, but it would be an unsupported factual claim. And I don't think if I say that to my neighbor, the police should come. But I think if I publicize it, I go on TV, I'm repeating it, then yeah, it would be fair enough to say, okay, now we're going to take legal proceedings.
So, in that particular case, though, is it necessarily the consequences that's determining how we treat the speech, or is it just the fact that we can disprove the thing that you're saying?
I would say that the times when we want to get involved in limiting speech are typically cases where the speech in question is not only false but harmful. So, as far as I know, and I grant it, I haven't looked into this, people who publish the idea that Bigfoot exists, I think they're wrong. Okay, maybe I can't prove that one, so maybe it's not a good example, but I would say I don't think it's harmful. As far as I can tell, I mean, some people go out and look for Bigfoot, but presumably they enjoy that. Or people who say the earth is flat. Okay, we can prove that's wrong. But as far as I know, it doesn't do any harm. It keeps some people amused, and other people don't walk around the earth because they'll fall off the edge. But, it doesn't seem to do any harm. But some speech is false and harmful. And again, if it's just me and my neighbor, who cares? But if it's a public forum, so the newspaper or a public talk or a website, then I think you should enter in and go, we are allowed to take legal steps given this. And I think that would cause people to watch what they say. Like saying the voting machines were fixed. It's like next time, given how much money they had to pay for having made that false claim, people, I assume, will hesitate to just spread lies like that.
So, where does hate speech fall into this? Because you may think that some hate speech isn't really factual. They're not making empirical claims. They're just making evaluative claims about a group of people, but it is harmful.
Unfortunately, I do think I would have to and would allow hate speech insofar as it is an expression of my emotion, an evaluation. And I think hate speech is awful, and I look down on anyone who engages in it. But I guess maybe because I want to be able to say child abusers are horrible people. I mean, that's a kind of hate speech. It's like, yeah, I think they are. If someone wants to say immigrants eat other people's pets, that's a factual claim and it's false and harmful and stupid. But leaving that aside, it's false and harmful. But if someone wants to say, I hate immigrants, I want the United States to only consist of people who immigrated a long time ago as opposed to recently, yeah, I would let him say that, at least in the public forum. And, there are different rules about private entities like, well, schools and universities and places of employment. But yeah, I would allow that expression as long as it doesn't vary into just making false factual claims.
So, how does that fit into the like harm aspect of your argument? Because it seems like hate speech can be quite harmful. And if that's what's determining what should be restricted in terms of your liberty, then why wouldn't that suffice?
I think that it is probably something about the precedent value that if we start to police evaluations, then it would, or it might start with ones that I don't know, all right minded liberals would disapprove of. But then you could also say, I can't say Trump is an idiot or things like that. I mean, I hate Trump. Okay. Sorry. This is coming out. I want to be able to say that. So I think that although, yeah, I would certainly, it does cause harm to engage in speech, again, especially against vulnerable minorities, which is what most hate speech seems to do. It does. But I worry that trying to restrict that, it's going to be, well, where do you stop?
Yeah, there's going to be a slippery slope.
Yeah. Whereas factual claims, I'm pretty good with saying, yeah, if it's false and harmful, it shouldn't be allowed. I don't see a slope. It's like it's true of all people.
Yeah, that makes sense. Okay, so what about in the case of medical ethics? You specifically mentioned respecting patient autonomy. Now, you didn't say this, but this is what I read into it. I assumed you were talking about getting vaccinations.
Well, so we typically say, and medical ethics texts say, you should respect patient autonomy. And they'll say, this is a new development. We didn't used to, but now we do. But it's not really true. That is, we respect patients' ability to say no to a treatment. So we think you really need such and such. You don't want it. We can try to persuade you, but if you say no, that's correct. But we never respect people's desire for a treatment. We don't say, oh, if you want an appendectomy, you can have one, even though your appendix is absolutely fine. We don't respect requests per se, because sometimes the patient might request something that's bad for them, like an appendectomy when their appendix is fine. Sometimes the patient might request something that's bad for other people. So, we talk about overuse of antibiotics. Sometimes the doctor will say no because they're overused and you're going to be okay anyway. And doctors can refuse a request for treatment just because it would hurt the doctor because the patient can't pay. So it's never the case that we really say, oh, you have to do what the patient decides. We weigh the costs and the benefits. And often, especially historically, it has been costly, to say the least, to impose a treatment on someone who didn't want it. So there are cases of women who were sterilized against their will. There, I mean, you don't even have to get into the Nazis. There are lots of mistreatment. So historically, yes, imposing a treatment could be absolutely wrong and it shouldn't be done. However, yes, in the case of vaccinations, and I'm not even going to talk about COVID, we can leave it more hypothetical. If the vaccination is not harmful to the individual and the disease is really harmful to others and really contagious, yes, then I think we can say you have to get vaccinated.
So when you say that, we should impose a vaccination on the people, that suggests that there has to be some sort of cost or punishment on people who refuse.
It's interesting that during COVID, although in the United States there was certainly no mandated vaccination, lots of employers did mandate it. And I'm not talking about left wing, super liberal employers. Lots of employers mandated it and they said either you get vaccinated or you lose your job. So, which is a pretty heavy sanction, especially during COVID when it wasn't easy to get another job. So, yeah, I do think there should be some sort of sanction. I think the easiest thing is to impose monetary fines, which is something we do for all sorts of things. And it's effective. It's effective in two ways. One, it's immediate. You don't want to get fined. Also, eventually, having a fine for something expresses social disapproval. And that tends to work its way into society so that the sanction isn't even, I won't say it's not necessary, but it's not the primary motivator for doing the right thing, like getting vaccinated. So we find people nowadays for not wearing their seatbelts. Depends a bit on the state. But and I remember, I'm really old. I remember when seatbelt laws were introduced and people were so outraged about this and, telling you that seatbelts are really dangerous and you'll die if you wear a seatbelt more than if you don't wear a seatbelt, blah, blah, blah. But they wore seatbelts because they didn't want to get fined. By now, fines are still out there, but most people just wear their seatbelts because they've come around to seeing that it's a good idea. I grew up, we didn't have seatbelts. When my kids were little, if I even turned on the ignition of the car, they go, it's not on. They were become inured to the idea that this is the right thing to do. So to get to vaccines and other sorts of things, yes, I think to initiate a change, you typically need a sanction. But then as people see that it's a good idea, because the vaccine doesn't hurt you and doesn't put nanoparticles into your blood or whatever these stories were, and they see that not getting vaccinated is bad for you and for other people, then you don't really need to apply those sanctions.
Yeah, what you said earlier about how autonomy is respected in medical ethics and how that doesn't necessarily mean that doctors just do whatever the patient wants. I feel like there's a distinction that's often made between negative rights and positive rights, right? So the negative right is the right to non-interference, and the positive one is a right to a good or some sort of service. And we generally think that negative rights are more important than positive rights. Now, how does that fit within your framework and within your argument? It well, first, do you agree? Do you think negative rights are more important to respect than positive rights? And second, do you agree because respecting negative rights tend to lead to better consequences?
I don't think negative rights are always more important than positive rights. So in the United States, you have a positive right to a public education, right? The state provides you with that free of cost. And we at this point do regard that as a right, to have something provided. And I think it's a really, 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 really important right. Now, I, on the other hand, have a negative right that you not touch me even with the end of a pencil. I mean, you're not supposed to do that unless I give you permission. But I actually think the positive right to education is more important than my right not to be barely touched with a pencil. I mean, I'm not for assaulting people, but I'm talking about barely touched with something. So it does depend on the consequences there. Education is really, really, really important. Nowadays, more and more people claim a positive right to medical care. And again, I think that's really important. I think historically, in the old days, it would have been really hard to provide people with a public education. We just didn't have the structure or the money. It would have been really hard to provide them with health care. And so it was easier to say, well, we'll just at least keep our hands off. We'll have negative rights. But now, in those places where it's actually possible to provide for what they need, I think a positive right to those things makes a lot of sense and is really important.
Interesting. Okay. So let's take a specific case within medical ethics. Let's say there's a patient with some sort of condition and the doctors are recommending a treatment. Okay. Everybody seems to agree that the patient can refuse with that intervention, let's say like surgery, right? Let's say, like, look, if you don't get your foot amputated, you're going to die. Okay. And the patient says, no, I just don't want, I would rather die. Okay. Now, perhaps like other people can agree that this patient ought to get that surgery, right? But we also agree that the patient has a right to refuse. So that would be like a negative right. From a more consequentialist perspective, I mean, we would probably say that it's, better for this person not to die, right? Than to die, even if it means losing a foot. So why wouldn't that, like your argument, just override that patient's denial or refusal?
Well, two things. As a general policy, carting people off to surgery screaming might prevent people from actually going to the hospital. So it's a bit worrisome about its general effect. In terms of the individual, I wouldn't assume they're better off alive with their foot cut off. I mean, granted, once their foot is amputated, maybe they could kill themselves, but there have been people who were gravely injured who preferred to die, even though they could have lived. They couldn't have been fixed. But so some people who are paralyzed, lots of people who are paralyzed are fine with that. They don't like it at first. They're horrified, but they adjust. But there are a few people who don't adjust and decide they want to die. Alzheimer's is not curable, unfortunately, but I've told my kids, if I get Alzheimer's, I know you can keep me alive and I may feel happy, but I want to die and please kill me if you can't. Uh, so continuation is not always the ideal. It sort of depends on that person. But to get to your case, this individual might really be wrong. That is, given their long term goals, they're not a gymnast or something where they can't imagine life without a foot. I think the best thing probably would be to use behavioral psychology. So, my first book was not about the limiting child birth. My first book was called Against Autonomy Justifying Coercive Paternalism. And in that, I argued that sometimes we irrationally choose something that's really bad for us, and it's okay to interfere. But ideally, instead of interfering by just grabbing someone and making them do something, you use their own cognitive flaws to kind of persuade them to do what's good for them. And I talked about this once to a group of doctors at a medical school, saying, look, we know that when you're talking to a patient, there are different ways of describing a surgery and its outcome. And you can describe it by saying it's 99% positive, or you can describe it by saying it's 1% of the time it fails. And those are equivalent, and a patient knows that. But just describing it in the positive way makes them more willing to choose it. So I think I would try to use that kind of manipulation, basically, to get them to go through the surgery. And furthermore, you can say, if you really don't like it, life could end later. Give it a chance.
Yeah, so you think nudges are justifiable.
Oh, totally. Yes. I think shoves are justifiable in some cases. Yeah.
Okay. All right, so let's switch gears and talk about the environment. I know you have views about how we ought to collectively address this problem. So, what do you argue for in the book?
Yeah. So, one problem with environmental harm is that it comes about through incremental damage. That is, no one person is causing climate change. Each of us does something ourselves, which isn't that bad, like we fly or we drive or we have 6 kids, that in itself doesn't make any difference. But if we all say, well, it doesn't make any difference what I do, so I might as well heat my mega mansion to 85 and heat my driveway, which people actually do in Maine. If people say what I do doesn't matter, well, they're right. But if we all think like that, disaster is going to occur. So, first off, I think we need to motivate changes by, again, a regulation. Because if I think it's just me, it's like, why bother? But if it's a regulation and we're all involved and there's a sanction, it's like, okay, there's a point to my doing what I ought to do. So when I think environmental regulations are good, because even though some people really care, if it's pointless, why would you act? Specifically, then, one thing I talk about is eating meat. So the meat industry does a lot of environmental harm. As we read about destroying the rainforest in Brazil to turn it into cropland. And that is certainly true and very dangerous, but it's true around the world, especially cattle. Raising cattle for meat does huge harm to the environment. And it makes people sicker. That is, eating a lot of beef is not good for you, typically. So I say, look, I don't say we have to be vegetarians, but I say it would be better for the planet and better for individual health if we ate way less meat. And we should do something about that. I mean, the easiest way would be to really, really tax it. But the problem with that is rich people could still eat a lot of meat and poor people could not. It would be, I mean, we have many of these cases, but yet another case where the rich could do whatever they wanted and those who were badly off wouldn't. So I still think taxing it might work. It's a simple thing to do. But I guess I feel like it would be better if we could do something that was less regressive. And actually give you like ration cards or something the way they did during World War II for butter and sugar. So you can get this much meat, something like that. Because it would be better for us, it would be better for the planet. So why not do it? Okay, people like meat. That's a reason why. I know that is a cost. You couldn't, especially have your super duper cheap McDonald's burger, but we adjust. The personal part, the adjustment is something that we do. We do it all the time anyway. I mean, food fashion is always changing. So,
Okay. So we covered free speech, we covered some medical ethics, and we covered some environmental stuff. I want to ask more general questions regarding this argument. So, if we're basing the value of liberty by its consequences, then it seems like how we, or to the extent that we should restrict a particular liberty, is going to be dependent on how we see the consequences to be, right? And so that means it's going to come down to some utility calculation.
yes, but I want to amend what you said a little. Whether we restrict a liberty is based on one, the outcome, but also you have to consider the cost of enforcement. So that's always relevant when you want to craft a regulation like this would be a great regulation, but making it happen would be so expensive, either financially or psychologically, that it's not worth it. But you consider all those things. And then you say, okay, what are the consequences of allowing it? What are the consequences of not allowing it once we factor in all those things? I don't like the word utility just because for many people, that conjures up strictly John Stuart Mill hedonistic utilitarianism. And it doesn't have to mean that. That's why I tend to just use consequences. So you're not tied to any very one narrow specific notion of utility. But yeah, you're basically right. We look at the consequences, including the costs of regulation.
Okay, so then that sounds like to me that, I mean, in one way, this is good, right? Which is that we can only really focus on the big stuff that everybody can agree it's bad, right? Because if 50% of the people think that this consequence is good and the other 50% disagree, then I'm not really sure how to, figure out how bad those consequences are, right? So climate change, okay, like assuming that, it's real, that it's going to get worse, everybody's going to agree that that's bad, right? Our health, eating excessive red meat, everybody can agree that that's bad, right? Maybe like a pandemic, everybody agrees that a pandemic is bad, right? So we can focus on these harms that almost gets universal consensus. But if we don't have that, then perhaps there is a harder case to make to restrict a particular liberty.
Yes. I mean, for one thing, again, I think an outcome is bad when it prevents people from getting where they want to go. And in your scenario, maybe the 50% here wants to go one way and the other 50% has other goals. And I can't say, well, these guys' goals are better. So yeah, then you might just have, I mean, what we sometimes do in legislation. Maybe there's a compromise, each side gets a little of what they want. But yeah, I wouldn't say one side gets to impose on the other.
Okay. So another more general question, which is who is included in this moral sphere? Are we only talking about human beings? Like, do you care about the pleasure and pain or the well-being or ill-being of animals?
Well, I do. But truthfully, insofar as we are crafting regulations and laws, we kind of have to go with what human beings want because they're the ones crafting the regulations and laws. And I would be happy to try to convince people that animal welfare should be included. Actually, I don't think that would be that hard. Well, that depends on your particular cultural milieu. But I think in the US, most people would say animal suffering per se is bad. And then if you say, what about factory farming? They try not to think about it. So I would probably say, here, you have to think about it, look at what goes on, that kind of thing to convince them. But ultimately, we have to go with the welfare considerations for humans because they're the ones who are going to either obey or not obey those laws. And you just try to get them to include animal welfare as part of their own goals.
Okay. What about future generations?
Well, again, I mean, I don't want to get into a whole, we could spend the next week talking about Derek Parfit and future generations, and I'd rather not. So, one, I think most people who are now living care some about future generations, at least their own children and grandchildren. And I think a lot of the people who are going to be harmed by climate change, for example, they're already alive. Young people now, old people like me, nah, I'll be dead before it gets bad. But it's going to be bad for people who are young now. So we don't even have to get into imagining people 10 generations away and what would they want. I mean, it'd be great in a way if climate change weren't going to happen till 1,000 years from now. Yeah, not. It's happening. Well, it's happening already, and it'll just get worse. So, in the short run, the problem of future generations, for me, is not a problem. I think they'll probably want what we want, and we want to live healthy, happy lives in an environment that allows that without having wars over shortage of arable land or drinking water or oil, or for that matter, pandemics, because there's so many of us, we are contagious and we won't get vaccinated. No one wants that, neither us nor those who will come later.
So, of all the suggestions that you make in the book, which one do you think is the most like, the most people would easily accept, and which one do you think almost nobody is gonna accept?
Gosh, I have something in there to offend everyone. One thing I say when it comes to medical ethics is this. Currently, a patient is allowed to say what will happen to their body after death. It may sound weird to call someone who's dead a patient, but usually treatment of the body after death is included as an area of patient ethics. And I don't think we should do that. I think we have lots and lots and lots of people who need organ transplants, who need cornea transplants, who would really benefit from a lot of organs that are going to go to waste if you just bury the person. So I think that whereas now we have an opt-in system where you can sign a card saying, yes, when I die, take my organs if they're useful. I think we should have a system that says that is the default option. That if someone, I mean, not everyone who dies is eligible, it depends what happens to you, but in those cases where the person's body could be used, we should use the organs that are useful, and then the rest can be buried or cremated or what have you. And I don't find that weird, but I have talked to people who are like, wait a minute, I'm for vaccinations, but my body's my body. And I'm like, yeah, but this guy's going to go blind and you want to just have your eyes rot, not a good idea. So that's a case I would interfere. I mean, it's common sense, but it's objectionable. Uh, so that's an objectionable one. One that people might accept. I mean, if it's way acceptable, I probably don't end up talking about it because I'm trying to initiate change. But maybe people would accept having some limits on what you can say about public figures. That you can say he's horrible, but you can't just outright lie and publish that widely.
Yeah, it's funny when you brought up the organ donation example, the opt-in versus opt-out example. I wasn't sure which one you were like, I thought you were giving that as the example that most people would adopt, but you're using that as an example that most people would reject.
Well, only because I've talked to a few people and they rejected it. And I was surprised because it's like, you're dead. What? Who cares? But it was off putting. And I don't know why. Maybe people fantasize that they won't really deteriorate, after they're dead. I don't know. But I have found people say, you should start with something more acceptable. Don't start with something like that. So, yeah, it's hard to say what people will find objectionable.
Yeah, in that organ donation case, I mean, I think I would say that is more on the acceptable side. Like, I feel like more people would be willing to adopt that because there's still an option to opt out under that proposal, right? So you can
I know
respect
I
someone's
didn't say
choice.
that. I didn't say it was an
Oh,
opt-out.
no?
No, I said it's not an opt-in system. So some places have an opt-in system, some have an opt-out. It's the default unless you say, I don't want to do it. I would say you can't opt out normally. I mean, maybe there's some kind of reason, but normally not. It's just that's what happens. And I've had people say maybe there should be a religious opt out. And maybe I don't know enough about how stringently some religions think you should not give up your organs before you are buried, or if there are. Yeah, like maybe it wouldn't be objectionable. I know that they say that although most people don't sign the card saying, yes, take my kidney, most people think they should. They just don't do it. And apparently, some of that is because it involves facing your own mortality. So, yeah, maybe, although despite the people I talked to, maybe if that was just the default, people would go, yeah, I was planning to do that anyway, but I didn't want to think about it. Now I don't have to think about it.
Yeah, I'm thinking having an opt-out system might be sufficient, but I don't, have any data to back that up. But yeah, if you're saying that you cannot opt out, then I can understand why a lot of people would be not amenable to that because then the default position is that the state owns your body.
I don't know if it's a state. I mean, the way donations go now, it's not literally through the state. It's through their different organizations in different parts of the country. They handle organ donations, which includes organs that you take from people who are dead, so post-mortem donation. But there would be a state regulation saying that whoever's there gets first dibs on your organs. And for some people, again, old people aren't always the best donors, but so I don't know how it would make some difference. And that's, I'd like to help people who are dying and all they need is an organ that someone else doesn't use anymore. So, yeah, save this person's life.
So in terms of the consequences then, are there any priorities given to certain groups of people? So this is why I'm asking this question. Sometimes I will have discussions with libertarians who tend to be in favor of more open borders, and one of the reasons that they will give is like, look, it would really help the global poor more if they were allowed to freely travel to the richer countries, right? So what the libertarians often will say is that, look, there's nothing special about you as an American or you somebody who lives in the West, right? You just happen to be born there, right? And that's morally irrelevant, right? And morally speaking, the person who's born in some other country, um, should have the same opportunities in life, right? So for them, they're not prioritizing certain people over others, right? And so for you, I'm wondering if you are on the same page.
That is, do I believe in open borders? Or I should
Oh
think we
no,
should
not the
care
borders, but
about
like,
everyone's welfare.
yeah. So everybody's welfare counts for one, kind of like the traditional utilitarian position.
Yeah, I think every person is equally important. You say that's utilitarian. I think Kant would sign up for that. Yes, all rational agents are equally important. Yeah. And then what you do after that, there's a difference between the Kantian and the utilitarian, but that everyone is due equal consideration. Yes, certainly.
Maybe part of my concern is really just the concern that I have towards more like consequentialist thinking in general. Like, I'm just worried that there would be situations where maybe the consequences would justify the restriction of a particular liberty, but it would still seem to be unfair or unjust for some reason. And I'm wondering maybe there would be something like that on a global scale. So let's say that maybe like it's true that the Western countries are more technologically developed. And because of that, we've contributed more to climate change than other countries. So if
Mhm.
we were to operate on a fairness principle, maybe we would say we have more of an obligation not to contribute to climate change because of what we have done in the past. But if we take a more forward-looking perspective, perhaps the bigger polluters are going to be these developing countries like China and India, and if we're coming at it from that perspective, maybe the restriction should be more on them than it is on us. But then that seems kind of unfair.
Well, I think the restrictions should be on everyone. Now, it's true that countries who have not in the past contributed to climate change will say, wait a minute, you guys got really rich and have this great lifestyle that you based on doing all this harm. And now all of a sudden you're saying, oh, that's wrong. You guys can't have the lifestyle that we have. Yeah, I think that's too bad, but I think it's probably true. They can't, we can't, no one can. So consider an example that people used to go tiger hunting, and there were lots and lots of tigers, let's say. But finally, they wiped almost all the tigers out. And you come along and you say, I want to go tiger hunting. And they say, you can't because there's so few left. You're going to wipe out the species. And you say, well, that's not fair. Those guys got to do it. Yeah, it's not fair in some cosmic sense, but we're not going to let you wipe out the remaining tigers just because other people got to have the fun of a tiger hunt. Sometimes you can't do what other people got to do because what they did was so harmful that if you do it, there's going to be hell to pay. And you can call that unfair, but it would be unfair again to your grandchildren to say, yeah, go ahead and wreck the world so that you get to do as much harm as those guys did.
Okay. I think it's a good place to wrap things up. Thank you so much for being here.
Thank you very much. It was fun to talk about. I hope everyone accepts my controversial conclusions as well as you do. So thank you for letting me talk.
Thanks for tuning in to The Ethical Frontier. If you want to support my work, you can do so at patreon.com/chenphilosophy.